echelon. It's increased, it's an increase, but much more is needed. Over to you.
Thank you very much, Dr. Pieperkorn. Dr. Zakaria, would you like to add something?
Thank you very much. I wanted to just highlight as well because the question did address as well issues of malnutrition-related death. And I think it is important for us to be able to know how many people have lost their lives due to extreme lack of food. But it's also important to remember that all of these deaths were preventable. And there are hundreds of thousands, over 600,000 people in Gaza who are facing catastrophic level of food insecurity. And so it is our collective duty to also make sure they do not lose their lives because we have not been able to scale up the aid at the level that we require. And it's also the same thing when we talk about severe food insecurity, especially the catastrophic level of food insecurity in so many countries. And that includes, of course, the population, the people of Gaza, but also those of Sudan, Haiti, South Sudan, Mali, and many other countries too, for which the number of those who are at that very critical level of food safety is also at risk of actually going into irreversible health consequences. Thank you.
Thank you very much, Dr. Zacharias. Next question, Kuna News Agency. We have Iman Herji. Iman.
Thank you so much. Just a question. You mentioned actually the violation of the ceasefire in Gaza. Could you give an update on how many injuries did you register after the ceasefire? Thank you.
Thank you very much, Dr. Pieperkorn. If you have not heard the question, it was, do we know the number of casualties reported since the ceasefire took place?
I quickly have to go back. I think it was over 80, but I'm not over 80. I have to get the correct number though, but I think what I saw in my mind was over 80. Over 80, we will get back later. Maybe can I address the one question on malnutrition, the former question on malnutrition, just coming out of Gaza 2 weeks ago when the ceasefire were announced. So the food situation has slightly improved. But it will take a lot more to actually reverse the situation. It's good to know that a new IPC analysis is underway, and that will shed more light. Overall number, what we've seen that 411 people have died in 2025 from the effects of malnutrition. Of them, 109 were children, including 84 under 5s. Over to you.
Thank you very much. And I think Mr. Nabil has figures that have been asked for.
Yeah, thank you, Tariq. So, yeah, just to complement strictly on the figures, and this is also figures coming from the MOH, since the ceasefire is in place, 89 were killed and around 317 total injuries, according to the MOH. Thank you.
Thank you very much, Mr. Tabal. Now we go to next question. We have Christian Ulrich from German news agency DPA. Christian.
Thank you, Tariq, for the perfect pronunciation of my last name also. I would like to get some more details on the medical evacuations that Dr. Tedros tweeted about last night, the 41 children. Maybe you could give us more details whether these were injuries or sick children, and especially where they were taken and who's going to care for them now. Thank you.
Thank you very much, Christian. I guess we go back to Dr. Pieperkorn.
Thank you very much. So I think the matter of fact from yesterday, we talk about 41 critical patients. They were all children, including 105 45 companions, so over 180. It's the first medevac since the ceasefire. I can't give you yet full details on the countries because due to operational concerns and when the children will have arrived there, we will make sure that we will share that. I want to stress a thing about medevac. It's a flagship program of WHO. We aim, and we are very much ready to scale up to a minimum of 50 patients per day plus companions in line with the previous ceasefire. So still some figures. Since October 23, WHO supported a medical evacuation of 7,782 patients to over 20 countries. The estimate is, from the Ministry of Health, that still over 15,000 people still need medical evacuation. So our key asks are very simple. First of all medical corridors need to be opened. The most important one is to reopen the West Bank and East Jerusalem referral route. We've had discussions with hospitals, directors, East Jerusalem and the West Bank, and they are very much ready to receive those patients and the companions. That's the first and most important key ask. That would be a little game changer. Then, of course, a Rafah crossing to be opened for patients to get transferred into Egypt and possibly from Egypt to other countries. And a continuation of the medevac through Kerem Shalom to Ramon Airport, to other countries, and to Jordan. More, as the second ask, more countries must step forward to receive patients. We are currently planning medevacs for next week. We would like to plan medevacs for every other day, or actually, we would like to plan for medevac every day. Over to you.
Thank you, Dr. Pieperkorn. Let's go to FA News Agency, Spanish News Agency, Antonio Breto.
Very much, Tariq. This week in the European Union, the clocks are being changed to winter time. This is a practice that in recent years has increasingly been questioned. And this week, Spain, the government of Spain has called for it to be abandoned next year. So we have had the economic, energetic perspective, but I also would like to have the health perspective and to know what is the WHO position on this change of hour, whether it's beneficial or harmful from this health perspective. Thank you.
Thank you, Antonio. I don't think that we have anyone here who can answer, but we will definitely go to our colleagues and check if we have something on that, and I'll come back to you by email. Thanks for coming and asking that. I understand that Christian has a follow-up question. Can we go back to Christian?
Thank you. Yes, my follow-up is to Rick. Is the problem with more medical evacuations that you do not have recipient countries or hospitals who are willing to take them, or is the problem that Israeli authorities are not facilitating the move of these patients? Thank you.
Well, I think there's two major challenges here. One, we need all the medical corridors to be open. So one is definitely linked to the Israeli authorities, because I think we have advocated from the start of the crisis to reopen the traditional referral pathway to the East Jerusalem hospitals and the West Bank. Before the crisis, I think good to note that between 50 to 100 Gazan patients per day were referred to the East Jerusalem hospitals and to the East Jerusalem hospitals and to the West Bank hospitals. The hospitals are ready, the Palestinian Authority is ready to receive these patients, And that would be definitely a little game changer. We've also noted that a lot of countries are support that, and that a lot of other countries will support it. And also WHO, we are ready to then, for example, support the East Jerusalem hospitals and the West Bank hospitals when needed. So that's one. Then the other crossing which needs to be open is the Rafah crossing, which was already highlighted, etc. It would be another medical corridor for patients to be transferred to Egypt, and from Egypt possibly to other countries. And the other one should be constantly open is the Kerem Shalom to Ramallah Airport and Jordan. So yeah, from the Israeli authorities, we want more dates for these medevac crossings, but we definitely need more countries to receive patients. Because we always talk, I mean, like that, people ask me, oh, can more patients go to Egypt? You shouldn't ask me. That's a question for the Egyptian authorities. But we are incredibly grateful to specifically the countries in the region, like Egypt. They have received close to 4,000 Gazan patients already. UAE, more than 1,000. Qatar, I believe UAE 1,200. Qatar 1,000. Jordan, Turkey, etc. So we really plea with other countries as well to open up. I also want to clarify that we are currently with the approvals. I think, yeah, we are, I would say, currently working well with the Israeli authorities, but the routes are not all routes are open, and they prevent an increase in the medevac. And of course, more countries need to open up for these patients. And I also want to make a point that we, understandably, we always get a focus from countries. They want a specific group of patients and children. And we all agree with that. From the 15,000 patients still to go, 3,800 are estimated children. And they are, of course, a priority group. But I also want to say there's many elderly, many adults, many older children, adolescents, etc., which also need to be medevaced. And countries should be open for all groups, including their companions. Over to you.
Thank you very much, Dr. Pieperkorn. We have a question from Guillaume Berne from French International Radio, who says that his microphone is not working. But the question is about Ebola outbreak in DRC, and he's asking how could you explain the success of the response in ending Ebola outbreak in DRC. So maybe we can ask Dr. Maury Keita to join us and give us update on the response. Oh, Dr. Tedros.
So before we go to the Ebola one, sorry for raising my hand later. The medical evacuation, as Rick said, it's both ways. First is from the recipient country side. So far, 20 countries have received. Not more than 4 or 5 countries have received significant numbers. The rest, very few. So that's why Rick was asking, and I said it in my statement, if countries could really open up and welcome those patients who need critical care. So there is that side from recipient countries. Of course, so far, Egypt, Jordan, UAE, and Turkey, I think, have taken the most out of the 20 countries. But we encourage other countries all over the world to welcome patients for critical care. And the second part is from Israel's side. The number of medical evacuations are limited, once a week. For instance, we have done one last week after 2 weeks because of the Israel holidays. So one evacuation per week is not enough. And we are evacuating through just one or two major corridors, and one or two corridors are not enough. But the most impactful could have been if Israel could allow patients to go to East Jerusalem and the West Bank. That would have been actually a better option. So that's then in the hands of Israel to allow, because they could get service within close proximity. So if this could be addressed, then the 15,000 patients waiting for evacuation, you know, a significant number of them could have received some support immediately. Because the delay in medical evacuation, especially for some patients, means they could die while waiting for evacuation. And that's what happened, actually. More than 700 people have died waiting for medical evacuation. So those in the list are critical patients, and they need, time is the essence. So that's what we are saying. And then there was the other question which I wanted to add, but I also missed that, so I would like to add to that. Is there a shift in amount of aid? It's very difficult to say a shift. There is no shift, but there is increase in amount after the ceasefire, but what is entering Gaza is significantly below the required target, significantly below the required target. And that also can explain the second, can be an answer to the second question. Is there a dent in hunger level? So if the aid that's entering Gaza is significantly low, it cannot dent the hunger level. And the situation still remains catastrophic because what's entering is not enough. So the two actually questions are one and the same. So the answer is no shift in amount of aid because what's entering is significantly lower than what's expected, the target, even the UN target per day. And there is no dent in hunger because there is not enough food. And the other part of hunger is hunger takes also more time to have a dent. And that's why I think we said some days ago, especially in terms of players on the ground, Israel should allow more NGOs to operate, especially some of the international NGOs who have been operating in Gaza and who have been delisted should be allowed to work because need a surge to deliver food. But of course, the two should go side by side. One is the amount of food or aid that enters should be significant enough. And second, there should be also a good distribution system on the ground to reach all those who are affected. And then on the daily entry, the trucks, the number that's entering now is between 200 to 300 per day compared to the 600 target. And even from the 200 to 300 that's entering Gaza, a good number of the trucks are commercial. And many people don't afford to buy. So that also reduces the beneficiary size. So that's why, the dent in hunger, you can't even talk about it at this time. Thank you.
Thank you so much, Tedros, for adding these remarks. Let's try now to go to Dr. Mori Keita in DRC to tell a few words about Ebola as a response to a RFE question. Dr. Keita?
Thank you, Tariq. So I think the rapid control of this outbreak could be maybe explained by a conjunction of a number of factors like rapid case isolation and treatment. So WHO and MSF, for example, were able to establish one of the innovative, treatment centers, here in Bulape, and in which we have 2 intensive care units. So, which is, of course, a good thing for clinical care. So we also have effective vaccination strategies. So it's important to recall that we had 2,000 doses in the country before the declaration of this outbreak, so which allow us to be prompt in our vaccination. And we also use 2 strategies in this vaccination. The first one was the ring vaccination, so vaccinating case around cases, so contact and contact of contact, but also we also used a targeted geographic vaccination. Now we have been able to vaccinate like roughly 37,000 people in Bulape and surrounding areas. So another thing is also strong surveillance and outbreak management. So I think we were able to quickly detect the cases from the community, to isolate them, but also to follow the contact until the end of the 21 days. So another important aspect is also the community engagement. I think it's very important also to recall that this is one of the particularities in this response in Bulape. So we had a very strong community engagement. So all the community leaders are supporting us, the community members, because here we have like a chief in the chief, so traditional chief in place, so that are well respected by the community. And if they are supporting, or maybe if they are guiding the community, they use to follow, so which allow us also to implement all our intervention here. So one of the important aspect is also the logistics. So the timely logistics and the resource mobilization. And we were able, thanks to MONUSCO, to establish quickly the air bridge, because Bulape is a hard to reach area, so there is no roads to reach Bulape, but we're able to have this air bridge, which allowed us to have to transfer staff and supplies and so on. So this is a number of aspects which personally I think have contributed to the success of this outbreak response. Of